Oftentimes on the Exam Room podcast, we talk about the role that nutrition and a healthy diet can play with type 2 diabetes. We've heard all of the research there and the incredible things that it can do, but we haven't talked much about the role of nutrition in type 1 diabetes. What is the connection there? Well, that is what we will be exploring today when we are joined. I'm so thrilled that she's back on the show. She is the director of clinical research here at the Physicians Committee. She's the director of the Universe, and she's delivering you new health for a new year. Dr. Hana Kahleova, welcome back to the Exam Room.
Thanks for having me, Chuck. It's such a joy to talk about diabetes and nutrition. And as you mentioned, most of the time when we think about diabetes, we talk about type 2 diabetes. But what about if you have type 1 diabetes? Is there a role of nutrition? Is there something that you could do with nutrition that will influence your diabetes? So let me pull up my slides and I'll show you what we know so far. The number of studies on the role of nutrition in type 1 diabetes is much more limited. But at least we have a glimpse, and we also need more studies. And that's exactly why we're doing the podcast today. So the type 1 diabetes is an autoimmune disease that's characterized by beta cell dysfunction, where the beta cells in your pancreas will not produce enough insulin for the body's needs. So these people need to inject insulin for the rest of their life. But there's also a second component to the disease, and that's insulin resistance. And when I say insulin resistance, most of you are probably like, what? I thought that would be a mechanism that's included in type 2 diabetes, which is true. It plays a more important role in type 2 diabetes, but it's also present in type 1 diabetes to a certain degree. And insulin resistance is basically the inability of the cells to respond to insulin as much as we'd like. So insulin is like a key that opens the door for glucose to come into the cells. And if the door lock is jammed, that would be insulin resistance. All of a sudden there's insulin, but it's just not working, and it cannot open the door, and the glucose cannot come into the cells. And so, affecting the beta cells in the pancreas is much more challenging than influencing the insulin resistance. So we are trying to target the insulin resistance of as a component of type 1 diabetes through nutrition. And now with the limited amount of studies that has been published on the role of diet in type 1 diabetes, we realize that there's a big need for new studies. And I need to tell you, we came up with a research study that you can participate in, or your friends with type 1 diabetes can participate in. The study is a randomized clinical trial where people who are interested in participating will be, like with a flip of a coin, randomized to either follow a portion-controlled carbohydrate-watching diet, where you need to count your carbs and you need to watch your portions, or to a low-fat vegan diet consisted of fruits and grains and legumes and vegetables. Now, how are these approaches different? They're very different. The portion-controlled diet is relatively low in carbohydrates, and it's basically limiting the amount of glucose that gets into your bloodstream. So that's the sugar that's inside the blood cells, and we just limit the amount of glucose that's inside the blood vessels, and that's how we can regulate the level of blood sugar. The low-fat vegan diet is a high carbohydrate diet, right? There's fruits and there's grains, there's legumes and vegetables. All of these are sources of carbohydrates. And it addresses mainly the insulin resistance. The idea behind is that the insulin resistance is eventually caused by fat that's stored inside the cells, inside the muscle cells and liver cells where it doesn't belong to. So if we can get rid of this extra fat, the insulin resistance will improve. And since this low-fat vegan diet is very low in fat, the idea behind is that we will mobilize the intracellular fat, the fat stored inside the cells. Now, if you'd like to participate in the study, then what will you get? You will get weekly classes on Wednesday evenings over Zoom. You will get a Dexcom G6 continuous glucose monitoring system. So on your phone, you will see continually how your blood sugar looks like. But we will ask you to give us access to your data so that we can also help you if there is any adjustments that are needed. You will also get a scale, a digital scale. Vitamin B12, that's essential for people on vegan diets. We give it to all participants in both groups. Some medications also decrease the absorption of vitamin B12. And generally speaking, as we age, the absorption of vitamin B12 is lower and lower. So you will benefit from taking the vitamin B12 supplement. If you are in the portion control diet, you will get some resources. You will get the book Think Like a Pancreas. I wish all of us could think like a pancreas. I was really inspired by this. I was like, this is a great book. I mean, I wish all of us could think like a pancreas. And also a cookbook. But if you are on a low-fat vegan diet, don't worry, you will get other resources. You will also get a cookbook and a book from Mastering Diabetes, and also a companion book that will help you keep the fat content of the diet low. Now, we start in late January with this study, or maybe even early February. In the first week, we only change the breakfasts. Then in the second week, we change the lunches also. And then in the third week, finally, we also change the dinners and snacks, which means that all the menu is already changed. Now, you can probably imagine how the portion controlled diet looks like, but you probably don't know exactly what it means to be on a low-fat vegan diet. So for the low-fat vegan diet, the diet is vegan, which means no animal products, no meat, no cheese, no dairy, no eggs. It's low-fat. That means that the fat content is up to 20 to 30 grams per day. And we also keep the glycemic index low. When you look at the power plate, the diet consists of fruits and grains and legumes and vegetables. And how to keep the fat content low? You may be thinking, well, if I saute my onions, I need oil. But you can also replace the oil with soy sauce or vegetable broth, or you can use some water. You will be asked to watch the fat content of the packaged foods, like, for example, beans are perfect because the upper limit for the fat content is 2 to 3 grams per serving. And this particular can of beans doesn't have any fat in them. So it's ideal. And you may realize that some of the vegan foods will not be compliant to the dietary recommendations on the study. So for example, Amy's black bean burrito, when you look at the fat content, it's 8 grams per serving. So this would not meet the study criteria. Now, we know that glycemic index is important for people with diabetes. It helps with glycemic control. also with blood lipids and with body weight and with inflammation. And so when we look at our food groups, fruits and grains and legumes and vegetables, we can create categories. The low glycemic index foods would be lower than 55, medium up to 69, and high glycemic index foods at least 70. When we look at non-starchy vegetables, all of them are wonderful. You don't need to limit the intake of non-starchy vegetables at all. When we look at beans, it's the same. All of them are great. Your beans and split peas and your lentils, no limit on the consumption of those. The same is true for most of the fruits, except for watermelon, where you may need to be more careful with the portions, or with other juicy fruit like mango and pineapple. For grains, all the old-fashioned grains are in: barley and bulgur and corn tortillas and millet and quinoa and buckwheat and rolled oats. All of these are completely compliant. The same with rice bran and spaghetti and wild rice. Where it gets a little bit trickier is sweet potatoes and white rice and couscous. You need to be more careful with the portions. And there's also high glycemic index foods in grains and starches, baked potatoes and instant oatmeal and white bread, for example, or a bagel. Now, does it mean that you will not be able to eat any of those on the study? No. If you want to have a baked potato, you still can. You can just load up on veggies and have, let's say, bean chili with it. And that way you will lower the overall glycemic index of the meal. And the same applies when you want to eat a bagel. It's a high glycemic index food. But if you have just a small piece and have a lot of vegetables and low-fat hummus, you can still eat it and you will be compliant with the study requirements. So to summarize, the vegetables and the legumes are all low glycemic index and there's no considerations needed. For fruits, most of them will be compliant. There's just a few kinds where you may need to be a little bit more careful. And with grains, there are some additional considerations that are needed. Now, I need to let you know, if you want to participate in the study, there might be some up and downs in your blood sugar. If your blood sugar is going too high, you may need to include more vegetables and more beans with your meals. If it's running too low, we may need to adjust your insulin and decrease the dose before the meal so that you don't get too low the next time. There's also some digital resources. You can download the 21-day Kickstart program on your phone. And if you're interested in participating, I'd like to encourage you to contact our study coordinator, Tati. Here's her contact email address and her phone number. And we also have a study website, and that one will be posted below. So which diet is best for type 1 diabetes? The answer is we don't know yet, and we need your help to sort this out. Is it the carbohydrate watching portion control diet that limits the intake of carbohydrate? Or is it a high carbohydrate, low fat vegan diet? So we would greatly appreciate your help in answering this question, in helping us with the recruitment for the study. So if you have type 1 diabetes, or if you know someone with type 1 diabetes, or if you're a physician and you have patients with type 1 diabetes, please let us know.
Yeah, and you see the recruitment webpage right there on your screen. So pcrm.org/recruitment. And as Dr. Kahleova said, we will put a link in the episode notes below. Really important research because so often, and I was talking about this recently with Dr. Dean Ornish as well, is like so much of this focus with diabetes is on type 2. But now here we are with type 1. And I think that's really, you're going to be unlocking some answers, hopefully, for a lot of people. And I noticed that the Mastering Diabetes book was included in this study. And anecdotally here, Dr. Cyrus Kambata and Robbie Barbero, who put those two together, both of them have type 1 diabetes and have seen pretty good results. So that's just two people. We need a lot more than that to be able to have a definitive answer. And that's why you're doing the study. And I think that it's fantastic. So when does the study begin?
The study will start at the end of January or early February. So we have enough time. You have enough time to think about it, sign up, then enjoy your holidays and start with the diet after New Year's.
I like that. Start with the diet after New Year's. How many people say that? Oh, everybody, right? Okay. Well, listen, best of luck with the study. I hope to keep tabs with you to see how things are going. And then when it's through and you guys are ready to publish, I would love, Dr. Kahleova, for you to come back on and share your findings with us.
Thank you so much, Chuck.
All right. Dr. Hana Kahleova, thank you so very much. If your health IQ is a couple of points higher than it was a few minutes ago, go ahead and like this video or subscribe to the YouTube channel. And to take it even higher, head over to Apple Podcast or wherever you get your favorite shows. Look for the Exam Room by the Physicians Committee. Hit the subscribe button there as well and help to make your world a healthier place.